Hello everyone, Nick NK Active here. So let's have a chat about virtual consultations. I think virtual consultations and virtual healthcare, let's call it, was coming anyway. However, I think this pandemic and this COVID outbreak, as it were, has most probably forced our hands slightly, and it's sort of forced us to change and evolve. What I think is worth is that it's a positive. I think there is a lot more we can do virtually than people think that we can. And luckily, because we've been in this pandemic world for well over a year now, people are now getting used to having their medical treatment done over a video or a telephone. However, there are a few things that I think we need to consider. Because obviously, if you're coming into clinic with a pathology, we can't just grab that foot and ankle and do a hands-on assessment. However, one of the things that I am quite passionate about, I believe in, is history taking is absolutely key. I'm a big believer that actually if you ask the right questions and listen in the right way and just use the old saying of you've got two of these, one of these, you use them in that ratio, we can, I reckon, about 90% of the time get that diagnosis without physically having to do a hands-on assessment. However, it does mean that we have to really hone in on those history-taking skills. It does mean we have to be very precise in the language that we use. So if we want a patient to do a certain activity or movement, because we can't see the patient, during the virtual consultations, I will still get them to walk up and down. I'll still get them to do calf raises, still get them to move their foot in different ways in their lower limb to isolate different muscles. But I have to be able to articulate it in a clear and concise way that they can then understand. So that does make you really hone in on those history-taking skills. The other thing is also benefit that we do is we have a pre-assessment questionnaire. So before anyone sees us, whether it's virtually or in clinic, you fill in a pre-assessment medical questionnaire that is filled in correctly, gives us a lot of information so we can then really hone in on that consultation to try and make it as best as we can. And when we had to shut the clinic in March 2020, I think we were shut for 3 months. During that time, I think I'd done roughly 100 virtual consultations, just because people still needed treatment. And the thing it did for us, it then opened up to be able to then go and do stuff, people who didn't live near us. So we've seen patients in Hungary, seen patients in Australia, seen patients from New York. And then we've actually now started doing rehab over a virtual way as well. And the beauty of doing rehab over virtually is that we just use something like an iPad. We attach it to a tripod. We go in the gym. We can send pretty much anywhere in the world some of the rehab kit that we use to our patients. So we can then take them through that journey, take them through that rehab process. And over video, the only difference is that they're seeing us through a lens rather than face to face. But actually, we're finding that actually people are liking that aspect, especially when they can't get to clinic. So I think virtual healthcare is something that's going to be here to stay. There are some times where you just need to see someone face to face, and it's not the right type of person that's going to do well with that virtual consultation. So again, like with anything that you do, it's picking the right modality for the right patient at the right time. However, there are still plenty of patients where you may, for example, do that initial consultation face-to-face, but then you may then do all the follow-ups virtually. So take nail surgery, for example. You can't physically do the nail surgery virtually. That has to be done face-to-face. However, there's no reason why you can't look at doing redressings virtually. There's no reason why pictures can't be sent which are dated, uploaded to the notes to track progress. Foot orthoses, to take a scan, we'll use iPad, attach a 3D camera, and I'll still need to see the patient physically for that, but you can still do the fitting process virtually if you can, or you can still do the follow-ups virtually. So I think virtual healthcare isn't going to replace that face-to-face appointment, but I think there's going to be a nice blend of things going forward as we all become, sort of as a nation, more comfortable with the concept of doing it. I think it is here to stay, and I think it's only going to complement what we do. But my one big tip is sort of brush up on those history taking skills, because that's what's going to make the difference in that virtual consultation compared to your face-to-face. And do you know what? Doing a consultation virtually does really make you hone on those skills, and it is great practice. So that's sort of virtual consultations, what we do at NK Active. I hope that was useful. See you guys later. Bye.